We're at St. George's Cathedral, where the People's Budget Assembly is taking place. A group of diverse collective of trade unions, social movements and NGOs have gathered to voice their concerns, hopes and demands ahead of Wednesday's budget speech.
So we're here now to support, to say that no to the budget cuts, so that our people can see that they are being served very well, because we have voted for this government. It's been so long, and they keep on promising us on the things that they are not even fulfilling at the end of the day. So we are struggling as a black community, as a big people, because of they always saying that there are problems, but instead there are a lot of money that they are eating at the parliament, whereby there is the corruption, but who are suffering? It's the poor that are suffering. So we're saying no, we're here to say no to the budget cuts.
Representatives from various sectors are sharing insights on how the government's spending decisions will impact workers, marginalized communities, and public services. The atmosphere is charged with urgency and determination as attendees engage in discussions about economic justice, social welfare, and the pressing need for policies that prioritize people over profit.
I think sometimes when people hear budget cuts and they're not involved in the systems that are affected, they don't understand what that really means on the ground. But because I work in a hospital, in a public hospital, and I have for many years, I know what it looks like where you come to work one day and the number of nurses that you had the day before is less than it was. When you can't operate on patients who need surgery because the theatre list has been cancelled because there's no staff to run it, or when you try to write up a medication and it's just not available because we've run out of money to pay suppliers. So we actually see how this affects people's lives. So they wait much longer for treatment. Sometimes they don't get treatment that they need. It definitely results in suffering, and sometimes it results in preventable death. And this is heartbreaking for us to see as health workers. And we want the public and the politicians and the decision makers to see the impact of these budgetary changes.
We have heard the people's voices, and now it's time to see if the Government of National Unity has as well. I'm Sherie Vollenhoven with Cape Town Daily in Cape Town.